My name is Greg Stock. I'm the CEO of Thibodeau Regional Health System. It's my pleasure today to introduce Dr. Ricky Miller. Dr. Miller just joined the staff at Thibodeau Regional. He's an expert in radiology and specifically in interventional radiology. He's the only interventional radiologist in the 7 parish area here. And our goal or our aim today is to help people understand a little bit more about what he does. And I think you'll be very pleased when you hear about it. First of all, Dr. Miller, you're from Houma, Louisiana. He's got a great family, 4 kids and 1 on the way. His wife is from Raceland, and he went to high school in Houma and Nicholls State and on to LSU. And excellent training, outstanding training, and you excelled in your training. But what we'd like to do is talk a little bit about the main equipment or technology that you'll use and kind of how it applies to different types of illnesses. And it's often the case that you have a great young, well-trained doctor, but there's a set of tools and things they need to perform their work at a high level. And so early on, a long time ago, in our discussions with Dr. Miller, we had a discussion about a laboratory. It's called the robot, and a very sophisticated one. And so I'm gonna ask you. I know about it, but why don't you talk a little bit about that lab and what it is? It's a $1.5 million piece of equipment, very sophisticated.
Absolutely.
Talk about it some, Dr. Miller.
Certainly. So just for background or basics, interventional radiology, we use imaging modalities. So we use ultrasound machines, CTs, and even x-rays to perform minimally invasive procedures using a combination of needles, wires, and catheters, similar to what you would think of with a heart cath or a heart procedure where you open up vessels in the heart. We do that throughout the entire body in nearly every organ system. So with that, that imaging modality allows us to see inside the patient's body while we perform the procedure. This angio suite that we're building here at Thibodeau Regional allows us to blend those modalities, the ultrasound, the CTs, and the x-rays together using multiple data sets in combination to better improve medical care.
So let's talk a little bit about the application. What you do really helps all of the rest of our physicians. Let's take cancer as an example. And there are many examples, so it's not limited to just a few little things. It's a lot of stuff. But we're building a $40–50 million cancer institute that's about 50% complete. We've recruited a number of medical oncologists. We're treating twice the number of patients than anybody in the area, or more than that. And we're trying to make a real difference in that area. So medical oncology can be surgical, radiation, chemotherapy, and various other procedural things.
Oncology care, or cancer care, historically there's been 3 players thought of. Surgery, which is the goal. Unfortunately, a small percentage of patients are actually diagnosed in a state where they could be cured with resection. The second player is oncology, or medical oncology, where systemic chemotherapy is given to treat cancers. And the third player is radiation oncology, where physicians use radiation to target lesions or masses. Interventional radiology is quickly becoming that 4th pillar, that 4th player in cancer care. We have techniques that can be used in combination or alone to alter or to give alternative methods in cancer care to better outcomes.
Because every situation is different, and those 3 that you mentioned, sometimes we used all 3 of them, right, together, and now 4th. So what you're doing in essence is making our doctors and our staff more capable. They're more capable. So if you want to use a cancer program or a cancer center, that's one thing conceptually. Here's another one, a cancer institute. It's a different concept. This would be very much a critical part, in my opinion, of that concept of an institute that has lots more capabilities.
Absolutely.
How does this, what you do, help get better outcomes for patients? And again, we're just talking about a slice of all you do. This is cancer, but it's a lot more.
Certainly. Yeah. Just for example, say a patient has a particular type of cancer. and then maybe they just can't tolerate that systemic chemotherapy for one reason or another, or maybe they're not in a position medically to undergo a large surgery. We could step in, offer an alternative procedure, an alternative therapy that would be better fit for that patient's condition and give the patient the best opportunity for a good outcome.
That's awesome. Well, we were several states away at a big teaching program, and we went in there and they had this piece of equipment, and Professor MD, who was chairman of the department, I think that day they were using this equipment, inserting these little tiny radioactive beads into a guy's liver who had liver cancer. The precision by which the needle went in was, as described to us, was incredible. But of course, that's what you do. That's what you do. It's not just some big teaching place far away, but it's right here, effective in the next few weeks, right here at Thibodeau Regional. It's a privilege to visit with you today, and we'd invite people to learn more about Dr. Ricky Miller. He's an expert in interventional radiology at Thibodeau Regional Health Center.